Could a hidden nutritional deficiency be driving anxiety, depression, and other mental disorders? In this episode of Vital Signs, Dr. Jing-Dwan Yang, psychiatrist and expert in integrative and Chinese medicine, joins Brendan Fallon to explain how identifying and addressing biochemical imbalances may be a key to treating mood disorders.
Many dealing with chronic anxiety, depression, and even conditions like bipolar and schizophrenia pass through a treatment funnel of sorts before arriving at something that brings relief. For some, their needs are met at the top of the funnel through mainstream offerings like antidepressants and psychotherapy. Others go deeper into the funnel, perhaps over the course of years, before arriving at fringe ways of understanding mental distress and treating it that bring relief. Advanced or targeted nutrient therapy is one such fringe dweller treatment that is bringing relief to many, especially those with severe anxiety, depression, mood swings, and other mental distress caused by loss of zinc, vitamin B6, and other key nutrients. In short, these people have pyrrole disorder, or pyroluria, and it's often mistaken for major depression, bipolar disorder, and in some cases, even schizophrenia. Returning guest Dr. Jing-Dwan Yang has seen strong results treating patients with pyrrole disorder and related nutrient imbalances. Board certified in psychiatry and integrative medicine, Dr. Yang's treatment system encompasses modern medicine, traditional Chinese medicine, including acupuncture, and other modalities. Welcome to Vital Signs, where we learn how to get healthier from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendan Fallon. Dr. Yang, always great to have you join us on Vital Signs.
Thank you for having me, Brendan.
Before we start talking about pyrrole disorder, I'd like to go a little broader and look at mental health and how it relates to nutrient deficiency or excess in general. In terms of anxiety, in your practice as a psychiatrist and integrative medicine doctor, how often would you say that in terms of anxiety, nutrient deficiency or excess is relevant?
Well, I would say it is a fundamental factors. And anybody who went through medical school and studied biochemistry know that everything the brain produce, actually the body produce, involves the cofactors, involves enzymes, involves a lot of biochemical components that we call them nutrients. That actually is biochemicals of the human body. And therefore, for example, in the process of neurotransmitter production, you involve the biochemical process called methylation, for example. And this entire methylation cycles involves vitamins, minerals, and amino acids, and even fatty acids. So those are, we call them a nutrient. To me, they are biochemical medicine. So if you ask me, anybody who suffers from depression, anxiety, or anything that involves body or brain, when we look at biochemical level, we have to look at nutrients.
Could you give an example, Dr. Yang, in terms of a chronic mental illness where a nutrient solution could bring significant relief?
So going back to the topic you're trying to set up for our audience about the cryptopyrrole disorder, again, for audience, you may not know what cryptopyrrole is. Let's start by explaining what it is. It's actually a metabolite from the hemoglobin. You know, our red blood cell dies every 120 days. So every time the body will break them down, and some of the metabolites, like the cryptopyrrole, which is harmless, useless, just will leave your body through urine. Okay, so most of us will be fine. We produce a certain amount of it and it will leave our body. We're not even aware of its existence. That's why you never heard about it. However, there are certain population, for whatever reason we may not always know fundamentally, they're producing larger quantity of cryptopyrrole. In other words, every time they pee, they get rid of a more cryptopyrrole than average people. Why is that a problem? Because cryptopyrrole, as we know, is harmless, useless, you know. To get rid of more or less, it should be okay. But the one reason it is not okay, because the cryptopyrrole binds very tightly with vitamin B6 and zinc.
To see that full interview and others on how to optimize health, go to ept.ms/vital signs. Vital Signs offers general health information not intended as medical diagnosis or advice. Please consult your doctor before undertaking a new health regimen.